So, lack of transportation, a critical health access barrier for kids. What we found is that lack of access to reliable transportation is one of the most pervasive barriers to health care for children in the United States. And the result of that lack of access is missed opportunities for routine care. Now, you would think, okay, if a child has a problem, a health problem, and they need to be seen by a doctor urgently, they'll get to that doctor, and that is in fact true. You will have, emergency care is available in just about every setting, even if you have to air vac a kid to the ER. What we're talking about is the missing of routine care. And the reason that's important is because when you have untreated chronic illness or kids don't get immunizations according to schedule, what you have are the diseases and conditions that go from manageable to unmanageable. And the cost to the healthcare system is fairly astounding. And of course, the human cost in terms of kids missing out on educational opportunities and having a diminished quality of life is also fairly extensive. So, it's the routine care, kids not getting to well child treatment, et cetera, that really is the problem here. In health professional shortage areas, we found that such areas are also likely to be transportation disadvantaged, which is a double whammy in many communities. So you have rural communities where there aren't enough doctors and there isn't any real access to transportation, so the access to healthcare is that much more diminished. To address this problem, the Children's Health Fund decided about 6 or 7 years ago to launch a major initiative called the CHF Transportation Initiative. The challenge was to address transportation barriers to child health care access. We have major partners in the Kellogg Foundation and the FTA, and our activities include development of innovative models within our network of programs to address transportation barriers in the communities where they're sited. We have some very interesting policy and research initiatives to get at some of the issues, the underlying issues that need to be addressed to help resolve some of these issues, to do public education and advocacy work in Congress and in other fora to educate folks about the need to collaborate around these issues. What I like to think of when I talk about the medical home and I come before a transportation audience like I am today, to say that it's not enough for transportation providers to get the person who needs services up to the front door of the community health center or the mobile unit or what have you, that we think that transportation provider needs to be inside the door and to be considered part of the model, part of the team whose goal it is to make sure those kids and families have true access to health care. Thank you.